Hello and welcome to the Canadian Science Policy Conference being held in Calgary at the TELUS Spark Centre. I'm your host, Rob Hislop. This is day 2 of the event, and we're kicking things off with a discussion on healthcare right now. Joining us is Antonia Maioni. Thank you very much for being here.
Hi, Rob.
You're with the Canadian Federation for the Humanities and Social Services. Or Sciences. Perhaps you can tell me a little bit about that group first.
Sure. What we have at the Federation is a peak association of all of the different learned associations, scholarly associations in social sciences and humanities, and all of our institutional members, which are the universities across Canada. And what we do is advocate on behalf of social science researchers and on behalf of their institutions in terms of funding and other kinds of resources to be able to do research in these areas.
Okay, and today you're here talking about healthcare.
That's right.
And I found it interesting looking at the synopsis because it said the perceptions or misperceptions when it comes to the healthcare industry. What is your focus going to be?
Well, the panel itself is going to showcase 2 researchers in the social sciences and humanities. Janice Keefe, who is a specialist on aging, so she's going to talk to us about what it is that we're facing in terms of an aging population and how, in effect, some of the best ways or best practices we can use to deal with the aged, especially in terms of chronic care. Michael Rackless is our other panelist. Michael is a very well-known, not only health policy expert, he's a physician, but also he's been out there in the media talking about some of the challenges to healthcare and reminding us about some of the differences between perception and reality, including the kinds of costs that we have to deal with and kind of what's good about the system, not just what's bad.
When you look at the system, I found it kind of interesting here in Alberta recently because the Premier decided that she would go to the public to find out what their concerns are. It seemed like kind of an odd thing to do considering this government's been in power for 40 years. You would think that they would know about the healthcare system, you know. But the public, its opinion of the healthcare system is, to me, very simplistic. I want it to be efficient and cost effective. You know, I want it when I need it, and that's what it comes down to. The system, for the most part, isn't like that in many areas right now.
There are some big gaps in our system, but it's true that the public perception depends. And a lot of the public's perception depends on whether or not you've had contact with the healthcare system or whether you're talking about it more generally. People who have had contact with the healthcare system, again, if they've had an acute case, if they've been in an emergency situation, usually they've had terrific care. However, if it's about chronic care, if it's about elderly parents, if it's about children who need both social services and healthcare, then you see a lot more gaps. So I think in the Premier's mind, perhaps she wants to go out and find out what people are concerned about, but what she will find is that they're all concerned about the same thing, which is exactly what you said. Will the healthcare system be there when I need it?
Right. Well, that's the thing. Myself, I've had 2 instances. One, I detached a retina, and I was in the hospital and had surgery and was home within about 4 hours. It was amazingly quick. I can't say enough about the people that I work with. But then I also tore a tendon in my shoulder. By the time I could see a specialist a year later, he said there's nothing he could do. And so this is the system that we're working with.
That's right. We have a system that's focused on medical care, which is very good when you're very ill. But the problem is when there are other things going on with your body or with your mental state, that can be the kind of processes that need a lot more other interventions in the system. We don't have enough coordination of those interventions. We don't have enough, I think, thinking about the long-term impact of some of these more important things that aren't just urgent but also emergent and need to have steady but constant supervision.
So from the studies that you've seen, and it's probably too simplistic to put your finger on one thing, but is the big problem here is that politicians are reluctant to make major changes because they're afraid it might cost them their job, and this is still a sacred cow when it comes to the electorate?
Healthcare is a hugely expensive burden or responsibility for governments, and so to try to tweak it, as you say, can have costs, both monetary costs but also political costs. So many politicians who are more interested with short-term gains are just not that comfortable with putting so much investment into something that we might not see for a generation. And so I think that's what part of the pressure is in the system. But there's also interests, right? Healthcare is about allocating scarce resources. Everybody wants this stuff. And so you have entrenched interests in the system as well who want to make sure they're not paying the costs of those changes.
Well, it's interesting because it does cost so much, and governments will always trump how much they're spending on it, but it doesn't seem like we're getting our money's worth.
Well, this is where Canadians have to be, I think, a little bit more vocal and advocates for themselves. There is in terms of the amount of money that we spend on healthcare, we should be getting a Cadillac system. Mm-hmm. And so if we're not, then we need to make those concerns known. But we also want to think about that this is a system that was built predicated on the fact that need should come before ability to pay. And I think that if we want to keep that value in our healthcare system, we have to be clear to our politicians that if there's change, we still want to keep that value.
Right. When you come to a conference like this where they're talking about science policy, which seems like like healthcare is such a huge issue, so is science policy. What are you getting out of it?
Well, what I'm seeing is how incredibly rich we are in Canada in terms of being innovative in our science, in our research. We're leaders in all kinds of areas, and I think this kind of a conference brings that together. But it also, I think, shows and puts forward the fact that science has to be funded by research, that the only way we can move forward as a country in terms of our policy decisions is to know what's going on. The research that comes from really parsing the evidence is fundamental to Canadians.
Thank you very much for your time.
Thank you.
Appreciate your participation. We've been chatting with Antonia Maioni with the Canadian Federation for the Humanities and Social Sciences.